I know he's talking.
Recording is on.
He knows what he's talking about. So, gentlemen and ladies, I introduce Professor Francis Aina, my good friend for a long time. Maybe we leave the introduction because of the time and go straight to the point. He's talking to us this morning on environmental manipulation, psychotherapy through environmental manipulation. Maybe when we finish and then we still have time, we'll introduce him better for everybody to hear. So, Professor, I know you are welcome. The floor is yours, sir.
Good morning, my very good and beloved teacher. Good morning, everyone.
Thank you. Good morning and welcome.
Good morning, everyone.
Good morning, sir.
Good morning. Welcome,
Good morning,
sir.
Dr. Abona. I must particularly commend your effort at making me to be able to give the lecture today. You've tried a lot because the network has been a problem where I am. But thank God we are able to scale through now. So, good morning. So, let me go straight to the point. I'll be talking briefly on introduction to psychotherapy by environmental manipulation. So I'm Prof Aina, as I've earlier been introduced. So the brief outline of this lecture is as follows. Background and introduction. What is psychotherapy? Types of psychotherapy. Challenges of psychotherapy in Africa. Concept of psychotherapy by environmental manipulation. And application in Africa. The background and introduction to this brief lecture is that everybody, every individual, we aspire to live a very good, very wonderful, stress-free life as much as possible. But the reality is that in life, we are bound to face ups and downs, moments of disappointment, moments of challenges that seems to be overwhelming. And in the course of that, we may not be able to utilize our innate skills of overcoming such challenges. So in such situation, we need help. And that comes in hand the issue of psychotherapy. So in life, we all require this from time to time because by our human nature, we are bound to face challenges, we are bound to have proper issues that we defy our innate skills in coping. And that is the bedrock of the issue of psychotherapy. Now, what exactly is psychotherapy? There have been a number of definitions or descriptions given to psychotherapy. And by and large, they all point to the same meaning. And one, according to this individual called Priest, defines psychotherapy as a systematic application of defined methods in the treatment of psychic suffering and psychosomatic complaints, as well as life crises of various origins. You will see in that definition, that it is not necessarily all about illness that we need to utilize psychotherapy. Life issues, challenges, stressful situations, and more so as psychiatrists, of course, it comes into play that mental illnesses of various dimensions will need psychotherapeutic intervention. But we should all bear in mind that the application of psychotherapy is not limited to illnesses, but life issues that appear to be overwhelming. Secondly, Madu in 2015 has done a lot of works on psychotherapy. Also defines psychotherapy as a process that enables people to express their feelings and in a protected environment to listen to a person trained to listen with understanding and compassion. If you look at this definition, it makes a very valid point that to a person trained to listen, one of the vital skills of psychotherapy is ability to listen. You listen attentively, carefully, and you must allow the clients to be able to see that you are emotionally flowing with his or her narratives. So we need a lot of training to carry out psychotherapy. Many a times people confuse psychotherapy with counseling. We may not necessarily need training to carry out counseling, but for psychotherapy, we need a lot of training. Lay individuals, religious individuals, and friends, close relatives, neighbors, they can carry out counseling, but they cannot carry out psychotherapy because psychotherapy needs a lot of training as outlined by Madhu's definition. A more recent description by General Cherry in 2024 goes those that psychotherapy, also known as talk therapy, that is how some people classify psychotherapy, also known as talk therapy, refers to techniques that help people change behaviors, thoughts, and emotions that cause them problems or distress. So the same thing, if you look at all these definitions, they all have the same core stem in their description of what psychotherapy is. One, what we can deduce from this is from the word psycho and therapy, that is utilizing psychological skills in giving treatment or in giving intervention to individuals. And we should also look at this word, the use of clients. We may not necessarily be dealing with patients because life issues, apart from illnesses, we also need psychotherapy. Then we also need skillful therapists to carry out this psychotherapy. And one of the core ability of the therapy is ability to listen and also be able to interpret and apologize on what the client says. The listening ability is very, very important. There are various types of psychotherapy. We have individual psychotherapies, that is psychotherapeutic process carried out on an individual, on a person, involving just the client and the therapist. There's only one client that is involved here. Then there is also couple therapy. Of course, from the word couple, between an husband and a wife. When there are issues in marriage, couple therapy can be carried out, which is also a form of psychotherapy involving two individuals that are joined in conjugal relationship. So that is couple therapy. Then family therapy. Family therapy takes a step over couple therapy. In this case, it is involving the couple and the children. Sometimes, particularly in Africa, because extended family system is still very much in the vogue. So extended members or extended family members that were involved in the issue may also be as part of family therapy here. Then group therapy, which is the most important one we carry out in our health care facilities. I'm sure that virtually in all psychiatric facilities in this country, people carry out group therapy. And I can't go into details of the nitty-gritty of this group therapy. But in group therapy, of course, as the name typifies, involves quite a number of people. In group therapy, the individuals or the clients involved will have no problem. Sometimes in group therapy, the clients or individuals involved may have divergent problems, different problems, but they are brought together in group therapy for one reason or the other. So we carry out this particular group therapy extensively in our healthcare facilities in this country. Now, apart from the types of psychotherapy, there are techniques of psychotherapy also. That is the technical aspects. The technical aspects of psychotherapy. Examples of the various techniques include the following. We have the psychoanalysis psychotherapy. First, when we mention psychoanalysis psychotherapy, the big name Sigmund Freud will readily come into our minds. But because of time constraints, we may not be able to go into details of this. Then, apart from psychoanalytic psychotherapy, we also have brief psychodynamic psychotherapy. This is an offshoot of psychoanalytic psychotherapy because in the practice of psychoanalytic psychotherapy, the practitioners found out that it's very extensive, very lengthy, and go over months or even years. But the brief psychodynamic psychotherapy seems to conserve more time than the extensive and lengthy psychoanalytic psychotherapy. Then the very popular cognitive behavioral therapy, very popular all over the world, is also another form of technique of carrying out psychotherapeutic process. Then the humanistic psychotherapy, then the eclectic therapy. Most of the time, this is the type we extensively use in this part of the world. This is the technique we extensively use in this part of the world. Eclectic means bringing various forms of psychotherapeutic techniques, borrowing from various psychotherapeutic theories and techniques to fashion out a particular psychotherapeutic need for a client. And in this part of the world, because we are very religious, some therapists also tend to borrow from religious themes and fashion out the psychotherapeutic need of their clients. So eclectic means borrowing from different schools of psychotherapy to match them together and fashion out the psychotherapeutic skills needed for the particular clients. And most of us in this part of the world, this is what we tend to use. Now, coming to psychotherapy in Africa, why am I particular about psychotherapy in Africa? Our teachers, medical scientists, clinical psychologists of many decades ago, we found out that these various orthodox psychotherapeutic techniques, they seem not to be practically applicable as so to African clients. And it was a source of worry because psychotherapy was not extensively used in caring for clients in Africa many decades ago. So before the advent of the colonial rulers and the orthodox medical practitioners in Africa, the belief is that psychotherapy was being carried out by traditional practitioners. One way or the other, some of their activities were found retrospectively to be of psychotherapeutic benefit to clients. So, in other words, we can even say that the advent of psychotherapy in Africa was the coming of the colonial masters. No, psychotherapy was already in existence in Africa among the traditional practitioners. Some of their activities, as I mentioned, were of psychotherapeutic benefits to the client. Traditional African psychotherapy was in existence, as I mentioned earlier on, not necessarily to take care of the mentally ill or people that are ill or sick, but they applied this psychotherapeutic technique they knew to life problems, to life issues, even to community problems and issues. For instance, if I digress a bit, among the Yorubas of southwest Nigeria, in the olden days, problems that arose in communities that seems to be overwhelming, the rulers of that time, they would consult the Ifa diviners to divine their Ifa, to use their Ifa divination to unravel the problems in the community and to provide solutions. Quite a number of times, these interventions, these traditional interventions will set psychotherapeutic benefits, not only to individuals, but to the community as a whole. In the olden days, the issue of marriage, traditional diviners will often be consulted to find out some things about how such marriage will go, whether the partner being chosen is the right person. The same thing in the choice of the Obas, the traditional rulers. Most of these traditional diviners were often consulted. And quite a number of times we found out that some of these aspects of their practice were of psychotherapeutic benefit, not only to individuals, but only to the community as a whole. So before the advent of the colonial masters, psychotherapy was being carried out in Africa. It was being carried out in Africa to help the community and individuals solve their problems. The traditional African psychotherapies may not be scientifically conceptualized or documented before the advent of the Western Orthodox era, but they were in existence to meet the therapeutic needs and the need to unravel some stress and problems in the African community then. The traditional African psychotherapeutic techniques largely involve the following. As I mentioned earlier on, divination. For example, the Ifa divination among the Yorubas. Other appellations are being used in other African countries, aside from this Ifa used by the Yorubas. For instance, the Hausas that spread across the West African sub-region. The northern part of Nigeria, Ghana, Mali, Burkina Faso, Niger Republic, the North Africa, and Southern communities there. They use the appellation bookers to describe these traditional diviners. Among our compatriots from the eastern part of the country, they use the word Dibias to describe their own traditional diviners. Then, if you look extensively, they use different techniques. For instance, among the diviners in Yoruba land, they use what we call opele. Then some of them can use specially prepared special types of palm kernel nuts, and so on and so forth. Because of time constraints, I cannot go into nitty-gritty of this. In the eastern part of Africa, especially in Kenya, then also in Namibia, in Zambia, some of those traditional practitioners, they use special bones of some animals in their divination. But by and large, the principle is still the same across African countries in traditional divination. So divination is a major form of traditional psychotherapeutic technique used in Africa. For instance, for those of us that are familiar with Ifa diviners among the Africans, when you consult an Ifa diviner, unlike in orthodox medical practice, where you are expected to give extensive history of your problem and you talk extensively in therapy, in Ifa divination, when you get to them, they give you the cowries they use in the divination. You whisper inaudibly unto it, and you hand it over back to the diviner. He will now divine. He will tell you the problem. and he will also provide solutions to them. So unlike orthodox psychotherapeutic practice, in Ifa divination or traditional divination, the client does not talk extensively. He only whispers, to the divining instruments, and the diviner will now divine and give the problem. He will say the problem and also say the solutions to them. So that is a major difference. Then we also have traditional meditation. Traditional meditation is also an important form of African psychotherapeutic technique that is being often carried out. Now, I must think briefly here because some of the Anadura white garment churches we have now, they borrow this traditional meditation into their worship by telling clients with problems maybe to come to the church premises for some days or weeks to a spiritual confinement to meditate. So I don't want to go extensively into this because of time constraint. Then, apart from divination, traditional meditation, the other form is traditional dream analysis and interpretation. So far before the advent of Sigmund Freud, dream analysis and interpretation, there have been a lot of this has been in existence among Africans to analyze dreams and to give interpretation traditionally. Africans, native Africans, we hold dreams to a very large extent in our life. When we experience fearful dreams, people often consult to unravel the mystery behind the dreams. And if you read the work of Sigmund Freud, it gives various types of dreams. Because of time, I can't go into extensive types of dreams given by Sigmund Freud. But by and large, it will believe that some of these dreams will be prophetic. Some of these dreams can give what is likely to happen to the individual. So when an average African expresses a very fearful dream, they often consult the traditional healers to unravel the meaning of such dreams and to prepare to mitigate against the manifestations of such dreams in reality. So traditional dream analysis and interpretation is also an important form of African psychotherapeutic technique that has been in existence even before the advent of the colonial masters. There are sacrifices and rituals in traditional divination. Problems, issues, challenges of life, they are often solved by prescribing sacrifices or rituals to clients. Some of these sacrifices, they are psychotherapeutically unique to the clients. For instance, we know that sacrifices are offered to what people now describe as the devil, the witches and wizards, the departed ancestral spirits, the gods that are available in the realm. So sacrifices are usually prescribed and offered to appease these individuals so as to solve the problem of the client. So it's also a form of traditional psychotherapeutic technique because it gives a lot of psychotherapeutic relief to the clients involved. That is why there is a narration in Ifa lyrics that Miro Ebony Beni, Miro Igeniya, say Ebogini, Ogugini, Oni Bala. The interpretation is when you obey the practitioner by offering the prescribed sacrifice, it helps you and enables you to overcome your problem. There are little sacrifices and rituals here and there, with some medication, we make the sick or the individual in problem to get over the situation. The advent of Islam and Christianity religion also brought along their own psychotherapeutic techniques. So in Africa today, we have admixtures of traditional psychotherapeutic techniques, the religiously based ones, based on Islam and Christianity, as well as the orthodox psychotherapeutic techniques. They all exist side by side, and they are being patronized by Africa. What are the challenges of psychotherapy in Africa? The various African scholars, particularly psychiatrists and clinical psychologists, such as Olatawura, Binitie, Awari, Tefe, Monati, Obibo, Ogairi, Madu, Omuluabi, and so many others, have written about the application of Western forms of psychotherapy in Africa and the problems involved. As I mentioned earlier on, that there was a lot of big war against the wide application of orthodox psychotherapy techniques when they were brought to Africa because of the following reasons. Some of the factors are outlined here. Some of these challenges include: one, widespread somatization of psychological problems among Africans. Of course, we know that somatization is one of the important ways by which Africans express their psychological problems. For instance, some decades ago, it was postulated that depression was not known to exist among Africans. But when extensive research was carried out, it was found out that quite a number of patients with depression, they have a lot of overlay of somatization. And that was why the clinical diagnosis was often missed in those days, especially by white practitioners that were in number in those days. So for Africans, it will believe that we tend to somatize a lot of our psychological problems. Until date, from our clinical experience, we still know that a number of our clients, especially those with neurosis, those with depression, they tend to somatize a lot. Even the psychotic patients, they also somatize a lot. So there's a lot of somatization among Africans to overlay the psychological problems. I don't want to go into this theoretical explanation for this commonality of somatization among Africans. It will be a lecture for another day about the issue of somatization and the scientific explanation for them. The second aspect is the paucity of trained psychotherapists in Africa. Of course, we don't have enough psychiatrists, clinical psychologists, and trained psychotherapists even after today in Africa. So the overwhelming number of patients do not allow the time for us to carry out extensive psychotherapy. But be that as it may, this study group is trying to promote the utilization of psychotherapy despite the paucity of skilled individuals. We try to encourage people to carry out psychotherapy as much as possible. Because the issue is that quite a number of our clients, medication will not solve their problems alone. Medication alone will not solve their problems. I often teach my residents that in psychotherapy, the use of medication is to make the patient to overcome some of the symptoms. You have to be able to produce a conducive environment in code for psychotherapeutic intervention. That medication alone is not psychiatric treatment. We need a lot of psychotherapeutic input and rehabilitation in taking care of most of our clients. Then another important challenge to psychotherapeutic practice in Africa is relatively lack of belief in the effectiveness or usefulness of talking therapy. To an average African, when an African comes to the clinic, the expectation is that the doctor or the health practitioner will carry out extensive examination. It will prescribe so many drugs so that they can use these drugs to get rid of their problems. But when an average African comes to the clinic, and you say that what he or she needs is only counseling and psychotherapy. Okay. You say this person doesn't know what he or she is doing. After some few appointments, you don't see that they fizzle out. So psychotherapy is not yet widely accepted. Although some educated Africans know they now realize the benefits of psychotherapy, but it's not widely accepted as one would have expected for now. So the talking therapy is not yet widely encouraged in African side. Believe in preternatural and supernatural causes of psychological illnesses and life problems. And as an offshoot of this belief is the ineffectiveness of non-orthodox treatment modality over and above the orthodox method. For an average African, when overwhelming problem arises, or when illnesses or diseases are seen to defy regular solution, the first thing that comes to mind is what are the spiritual causes of this problem? Who are the enemies behind this issue? Let me pause and tell you at this stage that irrespective of educational attainment or social placement of an African, we are still attached to our roots of believing in the preternatural and supernatural causes of problems. My very beloved teacher, Professor Jude Harry, wrote extensive paper on this. I think in association with Professor Lapuda and these other problems, they wrote extensive paper. If I cite my library, I will get that paper where they made mention of this issue, irrespective of the social educational attainment of an African. We are still deeply attached to our roots. And when overwhelming problem or life crisis or issues arise, Africans tend to regress and to hold tenaciously to the supernatural and supernatural causes of life problems. So because of this, the orthodox derived psychotherapeutic technique is not wide, they are not widely applicable as one would have expected at this stage. Consequent to the above notable problems, African Orthodox practitioners have attempted to fashion out psychotherapeutic techniques that are relevant and widely accepted to the indigenous African clients. I will mention some of the examples of these laudable efforts. I can remember during my residency training, quite a number of African psychiatrists and a number of clinical psychologists, they gather together to form a body of psychotherapists. And a meeting conference was held in Lagos where I trained as a resident doctor. It was a very extensive gathering of psychiatrists from various parts of Africa, clinical psychologists that came together to form the group of African psychotherapists. And it was a very laudable effort. Quite a number of papers were presented, quite a number of psychotherapeutic skill techniques that could be used for Africans, they were propounded. I think another conference was held in Enugu, hosted by Professor Peter Ebigoden. But after then, I'm not sure the body has been in existence again. And it's quite painful because I attended the different conference and it was so educating, so it was an eye-opening conference. But I got limited knowledge because I was still a resident doctor, but I can never forget. I will still believe that this body can be resuscitated. I believe it can be resuscitated. close collaboration between the clinical psychologist and psychiatrist forming that body. And I think there were few counseling psychologists who attended that conference from some universities and from the universities there. A precursor to this, and was the conference hosted in Paris by late guru of psychiatry, Professor Ayo Binitie. It was a gathering of who was in African psychiatry then in Paris. A book was published and very educative and very extensive book on the outcome of that conference. So I think this study group will take it from here to resuscitate this body because it will be very beneficial to our clients and the practice of psychotherapy in Africa. Now, coming back to my slides, what are the examples of the indigenously derived psychotherapeutic techniques that have been proposed to help our clients? There's one work from South Africa. The term is constellation work. It was propounded by Bart Hellinger among the natives of KwaZulu-Natal of South Africa in the 1970s. I'm not too sure whether this technique is still being applied today. I'm not too sure. Then there's this harmony restoration therapy being promoted and propounded by Professor Peter Ebigo, very brilliant teacher of mine from Enugu. I think he was at the time the deputy vice chancellor of University of Nigeria, Nsukka. I happen to have interacted with him one-on-one. Very wonderful teacher. He gave me quite a number of booklets of his work he's doing in Enugu then. And these books are still relevant today. So he's a man that we can, if we can get in touch with him to resuscitate this body. So he is the author and the promoter of this harmony restoration therapy. We can't go into details of all this because of time constraint, but time will permit in the future, we can elucidate more on this. Then another wonderful effort is that of measurement therapy by Prof Tefe. He's a very wonderful professor of clinical psychology in the University of Benin, and University of Benin Teaching Institute. He proposes this measurement therapy based on his work among his Urubu natives, because the man is a native of Urubu and used extensive Urubu culture in carrying out this therapeutic intervention. Then the issue of psychotherapy by environmental manipulation, propounded by Ayo Binitie. Now let's go to the issue of the day, the central point of my lecture, that is psychotherapy by environmental manipulation, which I shortened to PBEM, psychotherapy by environmental manipulation. If you look at it closely, the other forms of orthodox psychotherapeutic techniques, their major attention or work is to pay attention to the individual's emotion, the mind, to work or to effect the psychotherapeutic impact. But psychotherapy by environmental manipulation is different in the sense that it focuses on the environment. It tries to modify the client's environment in such a way as to be psychotherapeutically beneficial to the client. So unlike the other forms of orthodox psychotherapeutic techniques that focus on working on the mind, on the psyche, on the emotion of the individual clients, the psychotherapy by environmental manipulation, as I mentioned, focuses on modifying, trying to effect some changes in the client's environment for the therapeutic benefit of the client. So generally, psychotherapy by environmental manipulation is a type of therapeutic technique where the client's environment is utilized, as I mentioned earlier, or modified to foster a therapeutically conducive environment beneficial to the client's psychological state or behavior. So it focuses on modifying or trying to manipulate the environment to the benefit of the client. Unlike other forms of orthodox psychotherapeutic techniques that focus on the psyche, on the mind, on the emotion of the client. So how did psychotherapy by environmental manipulation evolve? There are lots of controversies about the origin of psychotherapy by environmental manipulation. However, it is generally accepted that precursors to what is now known as psychotherapy by environmental manipulation include meliotherapy and ecotherapy. These are the precursors that gave birth or in which, or we put it in the other way, where psychotherapy by environmental manipulation seems to take its root from. The concept of psychotherapy by environmental manipulation is now widely believed to originate and be popularized from the work of our own guru of psychiatry, the late Ayo Binitie, a very wonderful professor of psychiatry in Nigeria. He was the one that did extensive work to popularize the issue of psychotherapy by environmental manipulation. And the credit of the origin of psychotherapy by environmental manipulation is often given to him nowadays. He published his paper on this work. I think he published about 2 papers on this work. I had access to this paper during my residency training. How did he come about practicing psychotherapy by environmental manipulation? He found out that then in Benin, just as applicable to other African clients, that people with psychological problems, they tend to attribute their problems to external forces, to external problems. There's hardly introspection among them, but they tend to externalize their problem, attribute the problem to certain witches and wizards. So the brilliant teacher of mine, Professor Ayo Binitie, in his characteristic manner, now felt that modifying this environment will be of therapeutic benefit to the individual. For instance, in one of his papers, he said one of the clients he was seeing that actually developed depression believed that a co-trader in the market was the brain behind her problem, and that was psychologically hostile to her and all sorts of things. So what she believed would be effective, Professor Binitie encouraged her to try it out, to do some things to do so, and the problem was solved. Patients that believe or clients that believe their problem arose from the affliction from witches and wizards, they might come in to also offer the sacrifices they believe in will solve their problems. That was how the issue of psychotherapy by environmental manipulation arose. Let me correct one impression here. It is not necessarily maybe spiritual content alone. It may be just physical modification of the environment, or social modification of the environment, or social intervention would be known as a form of the environmental manipulation to be of benefit to the client. Now, he was carrying out this extensively And he was getting very good results because patients were responding or clients were responding to this form of psychotherapy. Then, my humble self, I tried to carry on from where Professor Binitie stopped. I tried as much as possible to carry out a qualitative work on this. Some years ago, specifically between 2004 and 2006, when I published my paper on observed psychotherapy by environmental participation of prayer mountains in Nigeria. So I selected 6 prayer mountains in southwest Nigeria. The prayer mountains in Ikoyi, not Ikoyi of Lagos, but the village of Ikoyi in Osun State. After Ibadan, when you are driving towards Ile-Ife exit, you turn to the right to go to that village. There's a popular prayer mountain there, especially established by the First Apostolic Church. Then another prayer mountain I selected was another one in a village close to that Ikoyi. Then there's another one on the way to Oyo. I was also going there. Then another one in the Keji, the present location of the Ayo University. There was a very popular prayer mountain there then. Then another prayer mountain I used in my research was one in a village called Originating in the Ekiti State, in present Ekiti State. But the village is now called Ritualistic. So these were the prayer mountains I selected. So I used to go travel from Lagos on weekends to join their services, to observe what they were doing. And I was doing that for about 16 months, collecting my data before I published my data. Some occasions, they didn't recognize who I was. I would be appointed as interpreter to the preacher, and I was collecting my data. And I observed quite a number of modification of the client's psychosocial environment, prescriptions of some things like modify rituals, use of holy water, use of anointing oil, and so on and so forth. There are some things I cannot describe in the course of this lecture. But I found out that clients patronizing these prayer mountains, quite a number of them, they were able to get relieved from their problems. If all these people were to storm the psychiatric facilities, we will all be worn out and overwhelmed within a few days. So they are doing a lot of work. How do I will say, of course, in any human endeavor, we are bound to meet with some, reservations, negative impressions, and some fake people. But be that as it may be, by and large, quite a number of them, they are carrying out a lot of credible work on clients that patronize them. So thank you very much for the time to listen and for the problems we encountered initially, for your patience to listen. Thank you, Dr. Abiola, once again for making this facilitation to be possible. Thank you, my teacher, my very good teacher that interact with me as a friend. Is my big teacher, is a big brother, big teacher to me. It's right from my residency days, he has always taken interest in me. My very beloved teacher, Professor Udofia. Another one that has been very encouraging, I don't know whether my beloved teacher, Professor Judo, is on the platform. Then I cannot fail to pay tribute to my very late wonderful teacher, Professor Olufemi Morakiyo, who encouraged me extensively in this part of psychotherapy and psychosocial aspect of psychiatric practice. So thank you very much for the time to listen, and God bless you all.
Amen. Thank you very much, sir. We're grateful for your fantastic lecture, and it has been quite enlightening. Professor Dufia, sir.
Yes, thank you very much, Abiola. Professor Aina, thanks a lot for what you've talked to us about psychotherapy by environmental manipulation. And thanks for not just jumping into the lecture, but giving the background, because usually giving background has a way of making people situate things properly. Like I mentioned when you started, I mentioned to the people who are waiting that they will not regret sitting down and listening to you. And I honestly hope that those who waited have gotten the time worth. Like our tradition is, we're going to have comments and discussions for 20 to time for maybe 10, 15 minutes. Then the discussions would move on to the chat group, the WhatsApp chat group. I don't know if Dr. Aino is there. Dr. Abiola, you endeavor to make sure he's registered in the chat group so that he'll be present to answer questions.
Yes, sir.
Yeah. So, are there any comments or questions? Please, if you have any comments, you can unmute yourself and ask your question. If you are kind enough to let us see who is asking the question, it helps. So if you can let us see you as you're asking the question, at least one will be able to help and see the non-verbal communications and understand what the questions are about. So are there any questions or any comments?
Okay. I thought I saw some people who raised up their hand before. Professor Yunusa, I thought you were there, sir. You want to make comments? I saw your hand up before. Okay.
I think he dropped out. If I noticed, I think when I was talking, I noticed his network had issues or something like that.
Yes, sir. Maybe while Prof is here, I want to please.
There's someone who just flashed some message. Can you check, please?
Yes, sir.
Okay, so he's asking for a link to the WhatsApp group. That can be done at the end of the meeting, please.
Yes, sir. Someone say humble request for the presentation.
Yes, that one would be done also.
And they are also.
Yes, maybe since Doctor, I'm happy. Let me ask a comment. Professor, I know you mentioned that the people did not know what some of the prayer mountains you went. Some people did not know exactly what your role was and what you were doing. What can you just give us an idea? What kind, if you were to make a diagnosis, what sort of diagnose? Well, we agree that not every psychotherapeutic intervention has to be based on a psychiatric diagnosis. You clearly told us that when you were talking about the background. So, what kind of what do I call it? Human conditions were sorted out, were helped by this environmental manipulation?
Most of them were. Hello? Are you hearing me?
Yes, sir.
Yes, we're hearing you.
Most of them are patients with neurotic disorders, anxiety disorders, phobias, then somatization disorders. Most of them, those are the things that we observe in such situations. Then there are some cases of depression. But most of these clients were patients with neurotic disorders, especially with overwhelming somatic programming.
And Professor, I know what were for example, where I agree that going up a mountain could be environmental um, manipulation itself. But my imagination, my imagination is it just things like maybe rubbing oil 7 times or going around the mountain 40 times? Were those the manipulations, or the I don't know? You didn't give us, maybe I didn't hear well, the specific things the therapists, let's call them therapists for now, the preachers were doing. Was it just the movement to the mountain, or like
Hello?
yeah,
Hello?
I'm hearing you. We're hearing you.
Can you frame the question again? I couldn't hear it well.
No, I was asking that if you, because I didn't quite hear you mention what examples of the manipulation, environmental manipulations that were done. Was it just patients going up the hills for the prayers, or there were specific things? Because each time I hear it, my thoughts have always been that maybe they'll tell the people to drink holy water or move around the mountain 7 times, things like what really were the therapists or preachers doing to alter the environments?
As I mentioned, if you look at, if you come from my lecture, the psychotherapy by environmental manipulation focuses on the client's environment, not necessarily physical environment, but the psychosocial environment. You encourage what the patient believes will be effective in the treatment, especially from their perceived causes of their problem. For instance, a woman that Professor Binitie mentioned was a trader in the market. She believed that her neighbor was the brain behind the problem of not moving well in their trade, and as a result developed anxiety disorders with a lot of somatic overlay. So believe that the neighbor was the cause of the problem and do a lot of things to sabotage their own trade. So in our case, what exactly should we do to overcome the problem? I should believe that she has gone to see the native healers and they prescribed that she should appeal this woman and give me certain things to her. So what the therapist will do is once you see that these things will be psychologically beneficial and there's no harm at all, you now encourage the patient to do that. As long as the patient believes in it, then it will be of benefit. For instance, we know in extensive divination, traditional divination, they prescribe a lot of things that the patient can do to overcome the problem. So, in as much as they come to orthodox practice, you don't discourage them, because what we observe in environmental manipulation is that some orthodox practitioners, even if they don't believe in it, they discourage the clients from doing it. But you at psychotherapy by environmental manipulation, you encourage your patient in as much as the procedure is not harmful and the client believes it will be of benefit to his or her problem. So you carry out a sort of encouragement to do it, and you now assess in follow-up about the benefits of such intervention to the client's problem, to the client's psychological problems. Do you understand now?
Yes. I think I understand what you're saying. I do.
Problems and the solutions. As long as the solutions they don't cause any further harm to the patient's problem, the therapist utilizing that in conjunction with the patient or the client, in conjunction with the client, to be of psychotherapeutic benefit to the client.
Okay, I get that. Thank you very much. Thank you.
So 2 people raise up their hand that they want to make comment.
All right, please.
Dr. Imrana, kindly go ahead. Dr. Chibuzo will follow. Kindly unmute yourself. Dr. AJ Imrana, unmute yourself and make your comment, please. While he's doing that, Dr. Chibuzo, you can go ahead. Unmute yourself and make your comment. Thank you. Anoje.
Okay, sir. Good morning, Prof, and thank you so much for the presentation. I wanted to find out, because from what you've discussed, that means that environmental manipulation can only be used for neurotic patients. It can't be used for patients who have psychosis. I'm just asking because a patient who is psychotic also will, some patients will believe that people are after them and want to harm them. So I'm asking, this means that it can only be used for patients who have neurosis and not patients who have psychosis. Thank you.
May I make a comment on that?
Yes, sir.
In the use of
Yes, sir.
psychotherapy, even psychotherapists believe that, for instance, the orthodox psychotherapy techniques, it is believed that the patient must be mentally, must be able to understand what is going on, the procedure that is going on, but have some level of intelligence to be able to go along with the psychotherapeutic procedure. If the patient is grossly disturbed, for instance, we know that a patient that is very psychotic, acutely psychotic and grossly disturbed, it is not at that stage you can apply any psychotherapeutic technique. Medication needs to be carried out for the symptoms to be controlled and the patient to be, stable to a large extent enough to be able to carry out psychotherapy on it. So the requirements of psychotherapy, something, some of them are also applicable here. If the patient is grossly disturbed with symptomatology, of course, cannot go along with the psychotherapeutic intervention. You need to calm, you need to control the patient by giving some medication to be able to, understand and flow along with the psychotherapeutic intervention.
Yeah. Thank you very much, sir. I have a comment too. But please, before my comment, we should try and vote on the poll to register our attendance for this event. Please, let's go to the comment side, click on the poll, and click on the time interval that you joined. Thank you. Prof, sir, during your presentation, you mentioned some other elements of other psychotherapeutic modality that seems to be present in the environmental manipulation. You mentioned some elements of some other psychotherapeutic modality. For instance, like behavioral modification. There is some of the I encouraged somebody who may be having some depression to leave their house to move and go over the mountaintop. That's a kind of behavioral activity scheduling. So that on its own is also a form of other modality of psychotherapeutic um, uh, techniques that seems to be also applicable in this by that's the psychotherapy of environmental management. So it seems that uh, like you said that we use eclectic approach. So it's also taking some, even though it may not be spelled out, but it's taking some aspect of behavioral some behavioral activation schedule, behavioral schedules to be able to attain this for the individual. So because that's part of what is being practiced in behavioral activation. Uh, the other comment I want to make is also is that kindly you have pointed out to us that the possibility that we are dealing with the patient environment. That also include maybe the mind's environment, because you talk about the inner structure of the mind. The structure itself is there, then the surrounding element of the mind before the physical surrounding and the psychosocial surrounding. So I don't know whether you may give us a comment about the mind's environment itself that allows the inner structure to interface with the external structure. And I hope I'm able to make my confusion clear, sir. Thank you very much, sir.
Some of the things, especially the first one you mentioned, I didn't get it clearly, but let me just come in. In anything you are doing, either methods of psychotherapy, intervention, either orthodox or traditional, whatever. The mind, the psyche, there's a lot of interaction between the various faculties of the mind, and in this, even with the environment as well, behavior. Because what is the aim of psychotherapy, for instance? From the outset, you need to set a goal, the goals you want to achieve. The same thing here. For instance, what in psychotherapy by environmental manipulation, the belief or the major issue is that an average African client wants a relief from this distress he or she is facing, whether psychosocial distress or distress from illness, either physical or mental illness. What they want is a relief. Some people believe that in psychotherapy, the goal is for the individual to have a better understanding of the self and to be able to, go about reinforcing the skills to overcome life's distress. So a goal needs to be set. There's a lot of, in the various psychotherapeutic techniques that we use, all of them, they have basis. There is underlying theoretical basis for each school. And as I mentioned, for eclectic, they borrow from different schools to fashion out a particular psychotherapeutic intervention for a client. In environmental manipulation, of course, you will see that if you go into details of this, maybe in another lecture, you will see that there's an element of eclecticism in it. Because it's not solely on its own just manipulating the environment. You are trying to work with the psychosocial and sometimes the physical environment for the benefit of the clients, of the clients, or for the client's benefit. And of course, you see that in behavior, in the change in behavior in the patient. The patient, for instance, that was fearful with a lot of phobia, if your therapy is successful, there will be a change in behavior. There will be attenuation of the phobia or the fear in the patient. In any of these psychotherapeutic intervention, of course, you expect some changes in the behavior of the patient because of the relief from the psychotherapeutic intervention. So many of them, they are intertwined in a way. There's no one that is holistically so pure on its own. You will see some elements of see some elements of borrowing from here and there, particularly among the African clients where we use these things. It is difficult to just apply pure theoretical concept of a particular one for an average African client. I don't know whether I've answered your question, but the much I could hear from what you said was what I'm able to respond like this now.
Yes, sir. Thank you very much, sir.
Hello?
Yes, sir. You are able to address my concerns, sir. Thank you very much, sir. Please, for those of us who are here to register when we join the meeting, kindly let's go to the chat portion, click on the pool, and let's click and vote so that it can register when we join. And please, let's show that we will enter the meeting with our name so that you can register our attendance. Professor Dufia, sir.
Yeah, thank you very much. If there are no other comments or hands up, then it would remain for me to thank Professor Aina spending the rest of the past several hours and thereabout with us. Luckily, he himself has alluded to the fact that some of the details that are available for this would have to be done in a separate second lecture. So maybe we'll talk with him and see what time this can be done. And if there are any other people who want to spend part of the expertise they want to develop would be on environmental manipulation. I'm sure one or two people who would be interested would be able to arrange for Professor Aina to see them through with whatever is required to change them and make them have a little more detailed knowledge on the system. So It remains for me to thank Professor Aina and thank every other person who has spent the last hour or thereabout with us. And let us know that next week, if there are no holidays or things like that, we're likely going to have something else to discuss. So just check the site, check our chat group to know what is being planned for next week. I think that's the basic thing I'm going to say, Dr.